Well, we saw last week in San Diego and certainly this week along the Central Coast, so much smoke because of the fires. In some cases, people evacuating because it was too much to breathe in. And for pretty good reason. Smoke inhalation is the #1 cause of death related to fires. And there can be some long-term health impacts too. So we brought in Dr. Sabrina Fabi once again to talk about this. Dr. Fabi, a very timely topic here as we saw the wildfires last week and then obviously the last couple of weeks in California. Talk to me about some of the dangers and symptoms of smoke inhalation.
Yeah, well, 3,200 people die a year from this. So it's something really, really serious that I think we take for granted just because the quality of our air is always pretty good here in the United States. And so what we find is that you can really get injured 3 different ways. Sometimes just a decrease in oxygen, so just asphyxiating, right, can cause death and can cause injury, but also a chemical irritation to the lining of your lungs and the airway that, brings in air to those lungs can really cause swelling. And then that swelling can cause a closing of your airway, which we call a bronchospasm. And so you also decrease your ability to bring in oxygen. And then lastly, just from all of the chemicals and particles that are in that smoke, because we can't necessarily control what's in the smoke, a part of it is just some of what's actually being burnt. And those particles, which are rather large, can also get into our airway and block our airway, and we can actually get carbon monoxide poisoning. So there are many different ways in which we can get injured.
Is there some symptoms that you would know between just like, oh, it's kind of an irritating feeling, maybe I'll just stay inside, versus I really need to seek some medical attention here?
Right, so nausea, vomiting, headache, probably carbon monoxide poisoning. So you definitely want to seek care emergently. If you're having a level of coughing, hoarseness to your voice, that can be a sign that your airway is actually irritated. And there you'd probably also want to get out of whatever conditions you're in outdoors, get inside, and you probably want to get some oxygen. So you do want to call for help. And oxygen can be supplied through just a simple tube or sometimes even through a mask.
And I would assume, I kind of feel silly asking this, but I'm going to ask it anyway, because if I have the question, maybe somebody else does. Is there sort of a difference when we talk about smoke inhalation and secondhand smoke, like between cigarette smoke, which obviously we know has nicotine, but then you also mentioned the particles that are in like wildfire smoke. Are they both just as dangerous?
Well, a little different. Some people try to wear these masks that are intended to break up or to not let in some of the large particles, things that you may get at Home Depot. But this is not the same. They're not going to necessarily protect you from some of the smaller chemical irritants that can still penetrate through those masks and irritate the lining of your lungs. So I wouldn't take those for granted. I wouldn't just wear a mask and go outdoors. It's always good to kind of check just locally how your air control is doing, how clean your air is before you decide to go outside, because some people think that those masks are going to protect them from both small and large particles, and they only protect you from large particles. And so knowing that can also help, because especially little kids, their airway capacity is only so much, and they take in a lot of oxygen, and they're outdoors quite a bit. So their capacity, just like our older patients who have heart and lung disease, they're not going to be equipped to be able to handle that kind of pollution like someone who's in their mid-age and healthy.
Yeah, really good information, especially as we've talked about this red flag warning starting again tomorrow. Dr. Fabi, thanks for being here.
Thanks for having me, Jen.